Michael Boa, leave the vitamin billing packet closed.
Those were wellness add-ons. Customers appreciated them.
You told them the vitamins were free while billing insurance thousands per month.
Once is a mistake. Twice is suspicious. Michael Sean Boaz did this across 2 pharmacies, 14 fraudulent counts, and 4 straight years, and left a paper trail on every single one.
All the patients don't always understand benefit pricing.
This was not pricing confusion. You added products they did not ask for.
I was trying to help patients.
He would not be dispensing another prescription. Within 72 hours, federal agents with the FDA Office of Criminal Investigations, HHS Inspector General, and the Kentucky Attorney General's Medicaid Fraud Unit would be carrying sealed boxes of billing records out of 2 small pharmacies in western Kentucky. 4 years of fraud, 2 locations, $2.18 million stolen from private insurers and government health programs. A rural pharmacist who told his customers the vitamins were free. What they did not know was that behind their backs, he was billing their insurance companies up to $6,000 a bottle. Before we go any further, I need to ask you something. Have you ever actually read your prescription insurance explanation of benefits, line by line, to see what your pharmacy is billing? Drop a comment and tell me honestly, yes or no. And if you are not subscribed yet, hit that button. This channel covers accountability cases. The mainstream healthcare coverage does not want to touch, and we do it every single week. Michael Sean Boaz was born in 1979 in Hickman County, Kentucky, in the far western corner of the state, where the Mississippi River bends toward Tennessee, and the land flattens into soybean and corn. His father worked at the Fulton Railroad Yard, first as a switchman and later on a night maintenance crew. His mother taught 4th grade at Clinton Elementary for 28 years. Clinton, the county seat, had fewer than 1,400 residents and a single traffic light, a Dollar General, a Sonic drive-in, and 1 independent pharmacy on the courthouse square that had been in continuous operation since 1962. That pharmacy would eventually become his. Small-town Western Kentucky in the 1980s ran on a specific kind of trust economy. You knew your dentist. You knew your county clerk. You knew the pharmacist because he was the person your grandmother called when she got confused about which pill to take with which meal. And he was the person who filled your antibiotics on a Sunday afternoon if he liked your family. Michael Boaz grew up inside that economy. When he tore his rotator cuff playing 8th grade football, the pharmacist at Clinton Pharmacy walked out from behind the counter to explain his mother's insurance benefits card in the parking lot. That memory stayed with him. He later told a college classmate it was the moment he decided what he was going to do for a living. He graduated from Hickman County High School in 1997, ranked 14th in a class of 81. His yearbook quote was practical. "Work hard, come home." He enrolled at the University of Kentucky in Lexington that August, drove 5.5 hours east across the state in a hand-me-down Ford Ranger, and moved into a dormitory on the north side of campus. He majored in biology with a chemistry minor. His grades were consistent. His professors described him in written references as steady, respectful, and quiet. One noted that he was not the top of the class, but the top of the character list. He worked 20 hours a week during undergrad at a campus dining hall and sent portions of his paycheck home to his mother. He was admitted to the UK College of Pharmacy in 2001. Pharmacy school was harder than undergrad. Organic chemistry took 2 attempts. Pharmacology took every hour he had. He worked 22 hours a week as a pharmacy technician at a Kroger location in Nicholasville, counting pills behind a plexiglass window, watching how retail pharmacies actually operated from the technician's stool. He learned the pharmacy management software. He learned how insurance claims routed through the pharmacy benefit managers. He learned which drugs cleared the reimbursement chain instantly and which ones triggered prior authorization holds. He graduated with his Doctor of Pharmacy degree in 2005. He was 26 years old. He passed the North American Pharmacist licensure examination on the first attempt in July 2005. He was issued Kentucky Pharmacist License Number 019447 in September of that year. He took a staff pharmacist position at a chain drugstore in Paducah, 40 miles up the road from Clinton, and worked there for 6 years. His performance reviews from that period, later reviewed by investigators, described him with words that would sound hollow a decade later. Reliable. Detail-oriented in dispensing. Good rapport with elderly clientele. Volunteers for weekend shifts without complaint. One review from 2009 called him the kind of pharmacist a small town would be lucky to have. He married in 2007. First child arrived in 2009. He and his wife bought a modest brick house on the edge of Clinton in 2010 and started making the 40-mile commute back and forth to Paducah for his shifts. And then in 2011, the owner of Clinton Pharmacy, a man named Delmar Whittle, who had run the store for 39 years, put the business up for sale. He was 72, and his wife had been diagnosed with early-onset Alzheimer's. He wanted to sell to somebody from Hickman County. He wanted the store to stay open, because if it closed, the nearest pharmacy would be a 22-mile drive that a lot of his older customers were not going to make. Boaz was 32, married, one child, another on the way. He borrowed against a farm his in-laws owned in Fulton County. He took out an SBA loan. He bought Clinton Pharmacy for a price that neighbors would later describe as generous, both because Whittle wanted him to have it and because Whittle believed him. Whittle spent 6 weeks walking Boaz through the store, where the compounding equipment was kept, which suppliers were reliable, which customers had specific medication reactions that were not written in the file, which insurance plans paid promptly, and which ones sent EOBs no customer ever read. And one afternoon, standing near a small, dust-collecting shelf of rarely touched inventory near the back, Whittle picked up a plastic bottle of a first-generation antihistamine called carbinoxamine malate, and told Boaz that he almost never dispensed it anymore. He called it, in words Boaz would remember, and prosecutors would later quote back to him, a dinosaur drug. To understand what Michael Boaz did between 2017 and 2021, you have to understand how insurance actually pays a pharmacy for a prescription. A customer walks into a community pharmacy with a paper script or an electronic order routed from their doctor. The pharmacist verifies the prescription. The technician enters it into the pharmacy management system. The system generates a claim and transmits it, in real time, to a pharmacy benefit manager, the PBM, which sits between the pharmacy and the insurance carrier. The PBM checks the drug against the patient's formulary, applies contracted pricing, deducts the patient's copay, and authorizes payment. Within seconds, the pharmacy knows exactly what the insurer will reimburse. The medication is dispensed. The claim is paid, usually within 2 weeks. The entire architecture depends on one assumption. It depends on the assumption that the pharmacist is honestly reporting what was dispensed, in what quantity, for what medical need, at what cost. The pharmacist is the last human eye on the transaction. There is no clerk at the insurance company physically verifying that a bottle of vitamins actually left the shelf. There is no auditor sitting inside the pharmacy watching the counter. The system extends professional trust to the credentialed pharmacist because the alternative, in-person verification of every claim across every retail pharmacy in the country, would collapse the industry within a week. For most licensed pharmacists, that trust is honored automatically. But the architecture has a vulnerability. If a pharmacist decides to bill an insurer for a medication the customer never actually requested, or to bill for a rarely prescribed drug at an inflated price, the fraud will not be caught in the moment of dispensing. It will only be caught later, only if a customer notices, only if a routine audit surfaces an anomalous pattern, only if an insurer's fraud detection algorithm flags something odd, only if a co-conspirator eventually cooperates. Boaz spent 6 years running Clinton Pharmacy, honestly. He learned every gap in the system. He watched claims process. He watched customers ignore their explanation of benefit statements. He watched insurers approve payments on medications that older patients could not have named if they had been asked. He watched the wholesale to reimbursement spread on obscure inventory line items. And then, in 2017, he decided to test what would happen if he stopped honoring the trust. He started slowly. He always did. In early 2017, Boaz partnered with a pharmacist named Christopher Clayton Augustus, 42, from Paducah, to co-own a second store called Bardwell Pharmacy in the neighboring county of Carlisle. Bardwell had a population of 700 and change. The two pharmacies were 17 miles apart on Route 51, connected by two-lane blacktop that ran between soybean fields and drainage ditches. Together, the two locations covered the overwhelming majority of the retail pharmacy foot traffic for two entire rural counties. That geography mattered. It meant almost every household in Hickman County and Carlisle County was, at some point, on their customer roll. The first fraud stream was the vitamins. Boaz identified a category of nutritional supplements that a certain class of insurance plan would reimburse under specific prescription codes. The industry sometimes calls them boutique vitamins. They are not the $8 multivitamin from the grocery aisle. They are proprietary formulations marketed to compounding pharmacies that could be billed to insurance under prescription rather than sold over the counter. Boaz set up wholesale accounts with two suppliers. He began ordering the vitamins in bulk. Then he added them to customers' prescription orders without being asked. The mechanic was straightforward. A regular customer, usually a middle-aged or elderly patient with a chronic condition prescription and stable insurance coverage, would come in for their monthly refill. Boaz would greet them by name. He would pull their bag from the pickup shelf, and he would say, in the same friendly voice he used to explain drug interactions, that he had added a bottle of vitamins to the order, no charge, on the house. The customers said thank you. They took the vitamins home. Many of them threw the bottles in a drawer and forgot they existed. What they did not know was that Boaz had billed their insurance carrier for that bottle at prices ranging from $1,000 to $6,000. Some customers received the vitamins repeatedly, refill after refill, month after month. The insurance company paid. The customer paid nothing at the counter and had no reason to look at their EOB. The vitamins piled up in a drawer, and the reimbursement checks arrived at the pharmacy's bank account like clockwork. One customer, later interviewed by federal investigators, said that he and his wife had accumulated approximately $30,000 worth of the boutique vitamins over the course of the scheme. They had consumed almost none of them. The customer also told investigators that his private insurance premiums had increased noticeably during the same period, and he had never connected the two facts until an agent sat down at his kitchen table and walked him through the billing records. The pediatric exposure was worse. Some of the boutique vitamin formulations carried explicit warnings that they were not intended for administration to children without direct supervision by a licensed medical practitioner. That supervision did not occur. Boaz at times added the vitamin bottles to prescription orders for families with young children, and the vitamins ended up in medicine cabinets that included pediatric patients. He billed the insurers regardless. The sentencing memorandum would later note this specific detail in a single flat sentence, the kind of sentence federal prosecutors write when they want a judge to sit up in his chair. The second fraud stream started later that same year. This one was colder, more clinical, and more architecturally damning. Boaz remembered Delmar Whittle standing near the back shelf. He remembered the phrase dinosaur drug, carbinoxamine maleate, a first-generation antihistamine, rarely prescribed, rarely audited, almost never on any modern doctor's prescribing radar. He looked up the wholesale price. A pharmacist could purchase carbinoxamine maleate from a licensed wholesaler for $605 per prescription unit. He then looked at what insurers, particularly certain private plans and government payers, would reimburse if the drug was billed as a filled prescription. Some plans would pay $2,000. Some would pay $8,000. In certain configurations, the reimbursement climbed to $16,000 per prescription, $605 in, up to $16,000 out, a markup of roughly 3 to 26 times the documented wholesale cost. Boaz began submitting fraudulent and unauthorized carbinoxamine maleate prescription claims across both pharmacies. Some of the claims were attached to real customers who had no idea a dinosaur antihistamine was being billed against their insurance. Some were pushed through under the co-conspirator arrangement with Augustus at Bardwell. Between 2017 and 2021, the two pharmacies together caused documented losses of $2,185,739 to healthcare benefit programs. Nobody noticed. Nobody checked. Customers thanked him at the counter and took home free vitamins. Doctors in Paducah and Mayfield did not receive alerts that a rarely prescribed antihistamine was being filled against their patients' insurance because the prescriptions were fraudulent and had never been written by them. The pharmacy management software processed the claims, the PBMs authorized payment, and Michael Boaz went home each night to his family in Clinton, drove a normal truck, lived in a normal house, coached at the county recreation league on Saturday mornings, and did not, by any outward measure, look like a man stealing $2 million from healthcare benefit programs. Before we get into how it unraveled, take a second and think about how many prescriptions you have filled in the last 5 years without ever once looking at your explanation of benefits. Drop a comment if you have ever actually read one line by line, and drop another one if you have not. Subscribe if you want to see how these schemes actually get built and how they finally break. We cover cases like this every single week, and the mainstream press does not. The unraveling started with an algorithm. Around late 2021, an internal fraud detection review at one of the private insurance carriers that had been paying claims from both Clinton Pharmacy and Bardwell Pharmacy flagged an anomalous pricing pattern. The specific anomaly was the carbinoxamine malate line item. The insurer's system was designed to identify prescription drugs where a single billing NDC was being reimbursed at rates disproportionate to the drug's national prescribing frequency and average wholesale price. Carbinoxamine malate hit both criteria at once. The drug was almost never prescribed in modern American medical practice, and yet it was appearing on claim ledgers from two small pharmacies in rural western Kentucky at reimbursement levels that would have been unusual even for a specialty compound. The insurer's fraud analyst pulled the underlying claim data. She spread it on a monitor. She noticed that the same billing pattern was repeating across a narrow window of pharmacy IDs in a specific rural corridor. She wrote a summary memorandum. She routed it to her supervisor. The supervisor forwarded the memorandum to the U.S. Department of Health and Human Services Office of Inspector General. HHS OIG opened a preliminary review. Within weeks, the file had been coordinated with the FDA Office of Criminal Investigations Metro Washington Field Office, under Special Agent in Charge Marie McGuire, and with the Kentucky Attorney General's Office of Medicaid Fraud and Abuse Control. The Kentucky Board of Pharmacy was notified. The U.S. Department of Labor joined the working group because parts of the affected reimbursement structure touched ERISA-governed plans. The investigation lasted approximately 2.5 years. Agents did not knock on Boaz's door. Not yet. They did not pull records at Clinton Pharmacy. Not yet. They did what federal white-collar investigators always do first. They pulled everything they could pull without alerting the target. Wholesaler invoices, claim submission logs from the PBMs, customer refill histories, insurance premium impact data, prescriber records showing whether any physician in Western Kentucky had actually written a carbinoxamine malate script for any patient billed by either pharmacy in the previous 4 years. Almost none had. By early 2024, the working group had built a spreadsheet showing every fraudulent prescription claim submitted by Clinton Pharmacy and Bardwell Pharmacy across the 2017 to 2021 window, cross-referenced with the wholesale acquisition cost, the reimbursement amount, and the absence of an authorizing prescriber. 13 specific prescription claims were selected as representative fraudulent counts. The conspiracy count was drafted separately. The evidentiary architecture was closed. The last step was arrest. Investigators visited customers first. They went to the kitchen tables of Hickman and Carlisle County residents who had, according to the claim data, received prescriptions they had never asked for. A retired schoolteacher in Clinton pulled a plastic Kroger bag out of her hall closet containing 11 unopened bottles of a boutique vitamin she said Michael had told her were free. A farmer outside Bardwell produced a shoebox of unused vitamin bottles his wife had thrown in a drawer over the course of 2 years. A young mother in Fulton confirmed that her pediatrician had never prescribed the supplements found on her family's insurance ledger, and that one of the bottles carried a warning against administration to her 4-year-old. The customer with the largest documented exposure was the man with the approximate $30,000 of vitamins. He walked agents through his file cabinet. He produced his explanation of benefit statements dating back to 2018. He walked them through his premium increase notices. He told the agent, on the record, that he had trusted Michael Boaz with his family's medications for nearly a decade and had never, not once, imagined the pharmacy was billing his insurance for merchandise he had never asked for. Investigators pulled the wholesaler invoices next. Every purchase order Clinton Pharmacy and Bardwell Pharmacy had ever placed for carbonoxamine maleate. Every corresponding claim submission. The two spreadsheets fit together like a hinge. $605 purchased, $2,000 to $16,000 billed, repeated across 4 years, repeated across both locations, cross-referenced with prescriber records showing no authorizing script for the majority of billed claims. They interviewed Delmar Whittle. The retired pharmacist, now in his mid-80s, confirmed for federal agents that he had personally handed Michael Boaz the store in 2011 and had personally described carbonoxamine maleate as a dinosaur drug during the transition period. That quote made it directly into the sentencing memorandum. It became the phrase around which the entire arithmetic of the fraud was framed. Co-defendant Christopher Clayton Augustus was approached first, in the spring of 2024. The proffer discussions went where those discussions usually go when the paper trail is airtight. Augustus indicated willingness to cooperate. On August 7, 2025, he pleaded guilty to conspiracy to commit healthcare fraud, fraudulent prescriptions, and aggravated identity theft. His plea locked in the co-conspirator testimony. The federal case against Boaz was now not only a documentary case, but a witnessed one. The United States Marshals Service arrested Michael Sean Boaz in June 2024. They came in the morning. 2 deputies, 1 federal task force officer, a plain sedan pulled up outside the small brick house on the edge of Clinton. Boaz was in the kitchen. His wife was pouring coffee. When he opened the front door, he was still in a short-sleeve button-down with a pharmacist's badge clipped to the pocket. The lead deputy identified himself. "Michael Sean Boaz?" "That's me." "Sir, we have a federal arrest warrant. You are being taken into custody on an indictment out of the Western District of Kentucky for conspiracy to commit healthcare fraud and 13 counts of submitting fraudulent prescription claims. Turn around, please." Boaz did not resist. He did not shout. He did not ask what the charges were. He asked one question. "Is Chris talking?" The deputy did not answer. Boaz stood in his own doorway for another moment. Then he asked if he could put on shoes. He was walked out of the house in handcuffs at 7:42 in the morning. Neighbors across the street watched from behind curtains. The pharmacist's badge was still clipped to his pocket when he was placed in the back of the sedan. He was booked into federal custody by mid-morning. His attorney arrived by lunchtime. He said nothing else on the record until his plea hearing 18 months later. The indictment, unsealed in June 2024, charged Boaz with 1 count of conspiracy to commit healthcare fraud under 18 U.S.C. Section 1349 and 13 counts of healthcare fraud under 18 U.S.C. Section 1347. The prosecution was assigned to Assistant United States Attorney Raymond McGee of the U.S. Attorney's Paducah Branch Office. The lead investigative agencies of record were the FDA Office of Criminal Investigations Metro Washington Field Office under Special Agent in Charge Marie McGuire, HHS OIG under Special Agent in Charge Kelly Blackman, the U.S. Department of Labor, the Kentucky Attorney General's Office of Medicaid Fraud and Abuse Control, and the Kentucky Board of Pharmacy. U.S. Attorney Kyle G. Bumgarner for the Western District of Kentucky announced the case publicly. Boaz's defense counsel filed the standard pretrial motions. A motion to suppress certain internal insurer communications was denied. A motion to sever the carbonoxamine maleate counts from the boutique vitamin conspiracy was denied. The wholesale invoice to claim submission spreadsheet, which prosecutors began referring to internally as the price to bill ledger, was ruled admissible as business record evidence. On November 3, 2025, Michael Sean Boaz entered a guilty plea. He pleaded to 1 count of conspiracy to commit healthcare fraud and to all 13 counts of submitting fraudulent prescriptions. The plea was open. There was no negotiated sentencing recommendation. The sentencing hearing took place on April 21, 2026, in the federal courthouse in Paducah. The victim impact portion included a written statement from the customer who had accumulated the $30,000 of unconsumed vitamins. His statement read, in part, "I trusted this man with my wife's medications for 8 years. I trusted him because his sign was on the courthouse square, and he called us by name. Now I look at that empty pharmacy, and I feel stupid, and I feel angry, and I feel afraid to trust the next pharmacist my family walks into." The sentencing memorandum, filed by AUSA McGee, laid out the full arithmetic. The $2.18 million in aggregate losses to healthcare benefit programs, the pediatric exposure, the Delmar Whittle dinosaur drug quote, the customer-side premium impacts, the 4-year conduct window, the dual fraud stream architecture, the co-conspirator plea from Augustus. The court imposed a sentence of 30 months in federal prison, followed by 3 years of supervised release. Restitution was ordered in the amount of $1,806,212.90. At the announcement, U.S. Attorney Bumgarner delivered the government's public statement. Fraudsters like Boaz that steal from healthcare benefit programs negatively impact everyone's healthcare costs. Healthcare fraud is a top priority of our office. We will continue to aggressively investigate and prosecute those that defraud our healthcare programs. It is my fervent hope that Boaz's prison sentence serves a strong deterrent to other fraudsters in the Western District of Kentucky to stop their fraud now, because we will find you and we will prosecute you. Boaz was designated to a federal correctional institution in the Bureau of Prisons' low-security system. Projected release in the second half of 2028. His Kentucky Pharmacist license, number 019447, was surrendered as a condition of the plea. Clinton Pharmacy closed its doors within 30 days of the sentencing. Bardwell Pharmacy closed shortly thereafter. The courthouse square in Clinton is now, for the first time since 1962, without a pharmacy of its own. The nearest replacement is 22 miles up the road, which is exactly the drive Delmar Whittle had spent his career trying to spare his neighbors from making. This case was quiet, but the case on your screen right now is louder, uglier, and closer to something that could happen inside your own family's medicine cabinet. Click it.